Yeah, so there is a whole new field opening up with the advent of CAR T cells. And what we are trying to do now is to consolidate the field on the basis of the data that we have generated. Of course, in the development of new fields, there's always a hype in the beginning. Right now, we are a bit beyond this hype, I guess, and we are trying to make sense out of what we've seen. So I think we can clearly state that in pediatric ALL and in young adults, we achieve a high rate of remission with the CAR T cells in patients who have been treated with allogeneic transplant, for instance. And in these patients, the question is really, can we sustain these remissions, high remission rates that we have, and where will CAR T cells be placed? Will they be bridging to another allo CAR T cell, to another allo transplant treatment, etc.? And so that's a big question. In the ALLs, we also have some idea on how resistance develops, because many of these patients develop CD19 mutations, and then the CAR T cells don't work anymore. So there is a field of research. And in the diffuse large B-cell lymphomas, we can expect that we can probably cure, or let's say achieve long-term remissions in 30 to 40% of the patients. But that also means that more than half of the patients do not respond or have relapses, and that's where we have to work on. So most of the research goes into breaking resistance. How can we make the CAR T cells more effective? And we will hear a lot about these things at this meeting. So there's a lot of questions coming up. The field will be going into expanding to other indications. We will get novel CAR technologies. The CARs will improve over time, and we have to put this into clinical trials and make it available for patients. I should also say that we are in an era where we have two of these products available for routine treatment, and there it's also important to have, let's say, national and international guidelines. Who should get these cells? Who is eligible? How do we select patients? Can we, by better patient selection, for instance, make more economic sense out of what we do? And how can we sustain this treatment? So those are the major questions. I will give a talk on this tomorrow, and I will cover mainly those fields. So where are we now, status quo, what are the problems, and can we establish a roadmap for research?